Good morning and welcome to the second annual WIMS Foodist Medicine Conference. My name is Dr. Stephen Meress. I'm going to be your moderator today. I'd like everybody to make sure they have some tea or water, or if you need to, coffee, and please be seated. We're going to get started right away. Good morning. Thank you all for getting up this morning so early. I know it's opening of deer hunting, and I know it probably really affected a lot of people in this room, but thank you again. I'm glad the weather cooperated. I wasn't sure if we're going to have snow, blizzard, or what was going to be happening. I just want to see a show of hands. How many people were at this event last year? Cool. That's really nice. We really didn't know what we were doing last year. We kind of got this thing off by the seat of our pants, and I think it really went off well last year. We're hoping for a better event this year, but we really like your feedback, and we did get feedback last year, so thank you for that. We're going to be doing something a little bit different today. We're going to be doing morning sessions in this venue. We're going to have a lunch, and then in the afternoon we're going to have some breakout areas. Now the thing about the breakouts this year, there's going to be 3 rooms. Each room's going to have 150 seats. There's 450 of you here. So 3 into 450 is exactly 150 people. So I'm not saying it's first come, first serve, but if you get there and if the seats are taken, your options are either stand or go to another venue. There will be seats for everybody. It's just I don't know if it'll be in each room. So I'm sure you'll be able to figure that out. What is WIMS? The Wisconsin Integrative Medical Society is something that a group of providers has been looking at for the last, I'm going to say 6 or 7 years. We would get together at times and we would talk about patients, we would talk about politics, we would talk about the future of medicine in the world of integrative medicine. And from those discussions, we started up the Wisconsin Integrative Medical Society really this year. Last year when we had this event, we really didn't even exist. We had a name, but now we are truly incorporated. We have a business, and we have a mission statement. And the mission statement I have up on here. It is to enhance the public trust in the quality of complementary and alternative healthcare delivery system in Wisconsin, and to advance the clinical practice of complementary integrative medicine among healthcare professionals and the public through education, like this event, collaboration, and innovative clinical research. Clinical research is still an area that we try to move forward on. Clinical research is what bases a lot of what we do in clinical practice into everyday medicine. This is me. I had to put this in. We're up in Fox Valley Wellness Center in Fond du Lac, Wisconsin. And when anybody comes to see me, when anybody talks about, well, what's really wrong with me, what's going on, I always want to lay the pillars of health. And I think it's important when we talk about medicine today, we talk about health, and we really don't want to focus on disease. As physicians, when we go to medical school, we get taught about disease. We never get taught about health. And I think that's the real critical thing when we talk about our practice of medicine. Looking for the cause is always the key. And some of the basis of that health pillars includes infection, inflammation, environmental concerns, nutritional, endocrine, and genetics. It will be on this list, no matter if you're dealing with a cancer, an infection, a fibromyalgia, a chronic fatigue, whatever it is, something on this list will be a culprit. I feel there's important words that we need to remember. And one of the things, again, that I say to my patients, the gut, the gut, the gut. If you have an abnormal gut health, you're going to have abnormal health. I don't care what we're dealing with. And that's why this conference is so critically important. Food is medicine. And I'm so excited about the talks we're going to be having today because it's going to complement what we're going to be discussing as far as health. Always come back to your gut. If you have any concerns, if you have skin issues, if you have hair issues, if you have any problem, always go back to your gut and ask some basic questions. Am I taking enough digestive enzymes? Am I taking enough oils? Am I taking enough probiotics? If you're not, take more. And it's not just for today, and it's not just for tomorrow, it's truly for the rest of your life. This is something that truly will not change. You've heard it before. We are what we eat. The better you do, the better you will do. And really, nobody's putting a gun to anybody. You're all here because you want to be here. You're proactive. That is so critically important. So many people want to take the easy road, but being proactive, taking care of your health is really what we're striving to do. Now, is this for everybody? And it's not. There are people that say, there's no way I can do that. There's no way I can stop eating the foods that I normally eat. There is no way that I can change my lifestyle. And it is not for everybody. But ask these questions. You want me to do what? Well, we want you to eat well. We want you to take care of your health, your body, your machine. I get this, well, really it's no big deal how I eat. Well, I think it is. I think it is what kind of fuel you put into your automobile. I think it's important what kind of fuel you put into your body. Does it really matter? It does. And again, the better you do, the better you will do. Just a few housekeeping events that we have to talk about. First of all, we are going to have a questions and answer session. It's going to be immediately following the 3 morning sessions. We're going to be doing a 15-minute questions and answers. We're going to be having lunch in this room. We're going to ask you to leave the room to look at the vendors, and the room is going to get set up, and then we're going to be coming back here. We're going to be having a lunch discussion. All talks today are videotaped. So you don't have to worry about if you don't get into the breakout that you want this afternoon, you can certainly find it on the WIMS website. And it will be videotaped, and it will be available to all registrants. The restrooms are directly behind us here. I want to make sure that if you have cell phones, that you have them either in a mute, in a buzz, or have them off, please. I do want to recognize our sponsors for this event. MD Custom RX is one of the main sponsors here. They're directly behind us in the vendor area. And I personally want to thank John and Monica and Dan for what they do at MD Custom RX. Truly, John has been one of the inspirations for this organization, and his dedication has really led us to this event today. And I thank you very much. The second sponsor is actually on the same slide, and Monica, I'm really sorry about catching you in midstream there with your mouth open. But our other sponsor is Orthomolecular, and they're right there on the slide. But Orthomolecular, Kara and Jack and Tom, I want to thank you for your support of WIMS and this organization. And WIMS, the Wisconsin Integrative Medical Society, as a group, we are involved with education, and we're going to keep striving forward for our educational plans. Our hope is to do something like this every year and make it better every time we do it.